You gotta take that out so I can see when people on there. See that close thing?
She's gonna close the right from
Okay.
this computer.
All right, here we go.
All right. You know, you do it, filler. You done these before?
Nothing particular.
Well,
No.
For a while until people get in there.
Oh,
So
okay.
tell you how many attendees are there.
Oh, okay.
So you kind of,
Yeah.
you know, people come and go. The technology is getting better. It takes a while to get folks in there.
Okay.
So, you know,
Yeah.
so those old messages get left. And then when people come in, they tell them, hold on, don't go.
It's cool.
Yeah, it's great that you use this.
You know, we move all that to the side. See? That looks great.
You know all the ins and outs.
And we live streaming too, so I better watch what I'm saying. Hello? So just hold on. This is Rodney Ellis, and we're glad you're here. If you've never participated in one of these telephonic town halls before, we do a little filler. It takes the computer a while to dial a lot of people. We got about 29, 30 so you all on the call right now. So if we seem a little redundant or if we repeat ourselves a little bit, we're doing that until we get a critical mass of folks on the phone. I got a great group of people here, including my fine staff members who helped put this together. Arisha Dawa, right?
Yes,
Did I
sir.
get it right?
Yes, sir.
And Lenise, thank you for the work that you all have done on this. I want to start off by thanking you retirees for the time you put into working to Harris County. And my staff want to make sure that I didn't forget to say that because we know that we are what we are as a county because of you. I think I saw a report today from some studies saying that Harris County, out of all the counties in the country, is number one in terms of growth, in terms of economic development. I'm proud that Precinct 1, wish I could take all of the credit, but the three major economic development projects, one is coming, has not been announced soon. I signed the NDA, I know, but would be Eli Lilly, which is in Precinct 1 out by Generation Park. And then the data project is in Precinct 1 as well. But so good evening, everybody, for being here tonight. This Tele-Town Hall meeting is focused on Harris County retiree benefits. About 221 of you on the call right now. I want to thank you all for being here. Your participation does matter. When we make decisions about retiree benefits, we want to do it with you and not just for you or on you or at your expense. I'm glad to be joined this evening by Andrea Coughlin Rowley. Tell me I got that right.
Yes, sir. Thank
Our brand new, maybe 8 months, a year?
you. 8 months, yes.
8 months head of HR, and Sarah Acosta.
Acosta, yes.
Okay, not Acosta, Acosta.
Yeah.
From our Human Resources Department, and Bhumit Shah, from our Office of Management and Budget. I want to make sure they spelled it phonetically for me so I didn't butcher your name. And of course, I mentioned Arisha earlier, senior advisor on our team. They spent months gathering retiree feedback, analyzing plan performance, and working with our insurance partners to develop proposed remedies to a problem that has come about. We also have representatives from Aetna and SilverScript on the phone available to answer questions later. I want to welcome everybody for being here. As you know, last year, Harris County transitioned retirees to the employee group waiver plan / SilverScript Medicare Part D plan. This change brought about some positive impacts but also real challenges for some of our retirees. I think it's important to take a moment to remember why we're here. We changed our benefits plan because of deliberate budget choices that I was not necessarily for, but no need me harping on the past. I was not for it, but a majority of the court decided to do it. And these budget choices prioritize increased funding in certain areas in our budget, even while facing a known deficit. In short, we dug about $120 some odd million hole in the budget, and that left us with having to make some real choices. We had to do some real trade-offs, and we're now seeing the impact of those decisions on our retirees. I've been very clear on my position from day one. Our retirees did not create this problem, and they should not be asked to carry its weight. I've said before, and I'll say it again, balancing our budget at the expense of our current employees, former employees, and retirees is not an acceptable option to me. At our commissioners' court meeting on May 1st, or in May, one of them in May, I directed the Human Resources Department to meet with retirees. You all had a plan that came forward. And I said, well, you need to go meet with the retirees, at least before I can vote on it, and hopefully sell it to them. That's why we're doing this call tonight, to listen to your concerns and hopefully develop a plan that ensures no one is left worse off. Today, we will hear about a proposed plan to rectify some of the concerns that have been heard, that we've heard from retirees, including 843 that are on this line now. Now I want to turn it over to Arisha to ask our department some questions, and then we will hear from the audience. Okay, Arisha.
Thank you so much, Commissioner. First, just a bit of housekeeping for the folks on the call. If you have any questions for our guests or want to share your experience or concerns, you can chime in by pressing the 0 key on your phone keypad, and one of our staff members will assist you. You can do this at any point throughout the conversation, and we'll answer questions after hearing from our speakers. If you're viewing the Tele-Town Hall online, if you're streaming it, you can also ask questions in the comments section. So now I'd love to turn it over to Andrea and Sarah to walk us through some of the key enhancements that HRT is proposing and how they will address some of the concerns raised by our retirees.
Thank you, Commissioner and Arisha, and we appreciate all the retirees who are on the call. So as you mentioned, we have been, at your direction, we've been engaging with retirees in a number of different formats. That includes the town hall that you alluded to, but we've also been engaging through phone calls, emails, and we did a survey. And so through all of that, we've heard 3 consistent themes. Retirees are concerned about having predictable prescription costs. They're very concerned about medications that may not be covered or may be harder to access in the new format. And they want to make sure that they have better assistance in navigating through the issues, whether it's a coverage issue at the pharmacy or what have you. And so the proposal that we're going to bring to Commissioners Court on Thursday, and that we can talk about tonight as well, will address all of those concerns. And I'm going to hand it over to Sarah, who did so much of the work to come forward with the proposal, to explain.
Okay, so one of the items being the plan design change. So that's addressing the cost and making it predictable. What currently is the
I
plan?
hope they can hear us. I know
Okay.
I'm sort of loud. Use an outside voice.
Outside voice. All right. So the plan design that is currently with Silver Script is based on what is in the commercial plan, what they moved from, which is a co-insurance plan. It has mins and maxes. Moved into that Part D structure and removing the ability to use manufacturer coupons has created a lot of that added cost because they can't use the coupons to lower the cost. What we're proposing and what we've worked with Silver Script and Aetna on is creating a flat co-pay structure. So it's not mins and maxes with co-insurance, and it makes it very predictable. So tier 1 drugs being $0, tier 2 being $20, which is your brand name drugs, tier 3 being the non-preferred brand being $35, and tier 4 specialty being $50. So it's very consistent. They know what they're going to pay at the pharmacy counter. And then if they get 90-day fills for tiers 1 through 3, it's only 2 of those combined. So they actually save a copay when they get a 90-day fill. And so that mirrors, in absence of the coupons, what they were experiencing prior. Because again, the plan that we live in with the commercial, what the employees have, is based on co-insurance and really needs, that coupon that's not part of the benefit design to help lower that out-of-pocket cost. And then that helps keep in the true out-of-pocket, that thing that we've kind of been talking about in the last couple of quarts. And what we've tried to explain is this mechanism, this protective factor that's part of Medicare Part D plans. And so it limits for the member what they're going to truly pay out of pocket. And so folks that maybe take really high cost specialty drugs, and they are out there. We've got folks that are taking maybe $15,000 drugs, and that's very expensive. And so from an experience standpoint, that true out of pocket helps make sure that they're not going to pay any more than $2,100 in this plan year, but it actually works even better because it's measuring against what's called the standard Medicare Part D plan. And we actually have a different version of Part D. So we have a lot of members, about 300 or so, that have already reached their true out of pocket and paying no more. They're not paying any more for their Medicare drugs. So they're $0 for the rest of the plan year. So, and on average, they probably paid, I think,
Under 1,000.
Under 1,000. So they actually didn't hit $2,100 because of how Medicare works behind the scenes. So again, there are protective factors with the Medicare Part D plan, and just trying to adjust that with plan design will immensely affect how they're experiencing that out-of-pocket surprise at the pharmacy counter. The other element is adding in a formulary. So we took the data. We've had 3 months of claims data. And so we had Aetna and SilverScript take that again and run it through the current formulary that we're in, but also an enhanced one, their broadest formulary, which is called Comprehensive Plus. What came back was that 99.9% of drugs would be covered under this enhanced formula. Basically only 3 drugs on that list, which are only used by 4 members. And again, there's a process for exceptions and such if they really need that drug to still cover it. And so that formulary helps address making sure that anybody that's had access issues, or maybe that prior auth is having some issues, or getting the exception appealed and all of that, they can have that on this enhanced formulary. And then the third piece of what the total proposal is that we add in the advocacy piece. So some of those nuances with Medicare Part D and just in Medicare in general, and I think just overall healthcare, like I have my mother that's on TRS retiree insurance, and I have my granny that dealt with all of that. So I think we all have elders in our our families and such, that it becomes quite complicated at certain times of life. And so having an advocacy team, which we actually already have supporting our Humana plan, just kind of broaden that reach, so that way it services our SilverScript members as well. And so they can be that middle piece between pharmacy, between the providers, helping make sure prior auths, exceptions, if there's questions about quantity limits, even doing some of that Medicare paperwork if they qualify for a low-income subsidy or such. That's something that they can help assist, and they would work along with the benefits team.
Remember, press 0 if you have a question, and we're gonna let you get to questions in a second. How many people, I'm curious, showed up at your previous? What's the largest number you had? People show
At
up
the town hall.
Uh-huh.
Over 100 in person, and we had over
203 online. So it's a hybrid.
So I just want you to know you got
Yeah, that's great.
1,000.
Yeah.
736 on this line. Now look, I do want to say to the folks on the line, I'm a retiree myself, so I could be your father or grandfather. I hope I don't look it, but I'm sensitive to these issues because I did take state retirement. Most people don't think about this. Is because of interning around the Capitol, state Capitol, being up when I was in grad school and law school, and as a staffer for a couple of years, clerking for a minute at a court, and then in the Texas Senate. And I remember I would always go to the HR office and just say, since my salary was $600 a month as a state senator, give me the maximum top tier coverage for my family and benefits driving back and forth to Houston. Well, driving back to Houston from Austin in case something happened to me. So in my case, I would have to write a check because it was costing with all of the stuff, taking all of the max. Just thinking, particularly when I was a single parent, if something happened to me, I wanted to take care of my family. Most people, everything you went through, we glaze over it until we're sick. And then you'll be amazed. Even people like me who didn't do well in biology, I haven't gotten sick yet, but when you get sick, that people I talk who are experts on all of it, more than I get from Chat GPT. They know it all. But I want to stress, it's complicated until you get there. The way we got here was when we went through the budget process, I did ask the question, will anything change? And I didn't run the tape, but one of my colleagues ran the tape. And the commitment was made, no change. Now, and it was going to save this plan, was it about 7 million?
No.
$9 million. And so it just sounded too real to be true to me. We could save $9 million and nothing would change. Nobody would lose any benefits. Now, as I understand it, I'm off script, I know.
It's okay.
But the people out that I've represented all these years know, and I'm prone to do that.
That's all.
So you all came back with options to try to make up. It was quick on the part of the staff, I must say. You know, we, Commissioners Court, made a decision, a budgetary decision, on the fly, so to speak, very quick. And you all scrambling, because you got to balance the budget. And then we found out things weren't quite as we expected. And then you all had several options on what to do. Now, I'm told this option will cost a couple of million. I read this.
$2 million, yes, sir.
$2 million. It'll be, some stuff will be different for people, but it actually is better for them. But it is different. You know, in terms of my experience with county healthcare issues, my doctor said I had a spot somewhere. Since it hasn't been cancerous, you know, I remember where it was for 2 years. Now I can't remember if it was the kidney, whatever it was. I didn't do well in biology. But so I first go get this, you lay in the machine, you don't move. You know, they were saying how obedient I was. I said, you telling me something? I'm going to stay real still in that cold machine, just sitting there. And then the next year, our insurance carrier at the time denied me. So I applied 5 times. And then I got the test. And then the next year, the doctor said, do it every year. If it grows, we don't want to go poking around in you and mess up something. It was more complicated. That's basically what they were saying. So they said, we're going to do this every year. Maybe the 3rd year, I got ready to do it. I was turned down again. Then I ran into someone from the carrier somewhere, and they were so happy to see me. And I said, I'm going to do my best to get your contract canceled. So then obviously, when I appealed, they changed mine. But I thought about, what about people who wouldn't be a commissioner, who run into someone at some community event and mentioned there was a problem. So I asked for data. Every time a doctor said do something, and then the carrier turned it down, because they're managing costs. That's what they're doing. That's what insurance is about. And that's when I, just being a retiree myself. So if my federally provided insurance does not cover something, Medicaid, which one is it? I get a mix up. Medicaid, care, Medicare. If at my age, if that doesn't cover it, then it flips to the county insurance. Then I still have the state insurance because it's different. And if I give the wrong one, I got to go through the billing stuff to get it right. You know, it's complicated. That's what this advocate, I guess, helps you work through. So I want you to just walk through what this $2 million option, which is probably the one I'm going to push, because I wanted you all, when y'all made it so, this solves everything, I figured, go tell them. Because they were innocent bystanders when we were doing a drive-by budget change. You know, so just walk through that again in simpler English. And then if you got a question or two, we'll answer. Then I'll let you ask these nice questions you worked up.
Thank you. And just to clarify, I think this would be the option with the enhanced formulary, the reduced copay, as well as the retiree service option. So all of it. Yeah.
Okay, correct. Yes.
Yeah.
Code, so
And
again,
remember, I'll be watching. If we go with that and it changes again midstream on the budget, I'm gonna put it back on the agenda and say, go make that hole up. Because I didn't create this $100 and something million hole, but I gotta live with it. We all do. So the $2 million option.
right.
We like to call it the win-win.
I just look at the money.
Yeah.
You know? So, because initially it was supposed to be nothing changed, but just walk through that.
Right, no, so the plan design changes it from what we currently have, even in our commercial, and as well what's in Silver Script now, from a co-insurance with a minimum and maximum. So that's where there's that variability based on what drug costs are. When you go to the pharmacy, the drug cost based on, how the coinsurance takes that amount, it could, be variable. It could be like $5, it could be 25.
And that's the commercial plan.
That's commercial, but that's also, how the silver script was structured and, how they quoted the rates initially last year. So this proposed plan design makes it a flat copay for every tier. So you've got $0 for your generic, which is what most of our members take. We have close to 90% of our scripts filled are generic. So that's great. That means folks are using like the cheapest option already. But for anything, above that, for the tier 2, which are your brand name drugs, those are the ones where all those coupons kind of live. That would be $20 a copay.
Could you give a couple of examples of those, Sarah? Yeah.
Let me flip to that real quick.
Because I know you have it. Yeah. Thank you.
I like that 7-week stay-off script. They're glad it keeps them awake, so they're sitting here reading a teleprompter.
There's no No, like, so one example is Jardiance. So that's a diabetes heart failure drug. Kind of on our current plan, that copay most likely looks like $150, especially if the member hasn't, or if the retiree hasn't hit their true out of pocket. And so moving to the proposed plan, that copay becomes $20.
It's a big difference.
Yeah, very big difference. I know Eliquis is also a popular one. Let me see. We come up with that one quite a bit. So that's another brand name drug. I know there are coupons out there. And so that's a blood thinner. And so that's, again, on the current copay plan, or not current plan right now, it's $150 if they haven't met that true out of pocket. And then on the proposed plan, it becomes $20.
We got a couple of questions up there. We're gonna run through them. I won't call your name out, but the first one up there, question, obviously you can see it there, is the county still with Humana? Why can't the county pay the full price of Ozempic?
The county still has Humana as a plan option. That's our Medicare Advantage prescription drug plan. It's one of the options that we offer for those that are Medicare eligible on the retiree plans. Regarding Ozempic comes as, follows the plan design as allowed. So I'm not quite sure how we would pay the full price of Ozempic if it's, following the plan design we have.
And look, just a guess I might add to it, and
Yeah.
we'll follow up with you to make sure we
Right.
won't call your name out. I see your name there, so we know who you are. I'm not on Ozempic yet. I'm dressed because when it cools off, either I'm going walk 3 miles a night, or I'm going to the gym. And just for what it's worth, what I've been told by my doctor, the Ozempic is it'll cut your appetite, but you still got to learn how to eat and eat the right stuff. Or once you get off the Ozempic, it'll get it down. Then it comes back. So, here's the diet for you. Remember this. If it tastes good, don't eat it. Remember that diet. All right, we're going to follow up to just ask, is the person following up there, are we automatically enrolled in Medicare?
This is another
That's
question.
another,
Yeah.
okay. Are we automatically enrolled in Medicare Plan B? I am a retiree.
No, you actually need to enroll in Medicare Part B when you become eligible for that. So you need to do that at least 3 months in advance, so that way things coordinate properly.
I hope this is helpful for you all. I'll let you read it. You can read the question. You just don't call that name out. They may not want folks to know here.
Right. So this question: why are prescriptions more expensive with SilverScript than when we had Aetna? Costs have grown significantly since the change. So again, prescriptions, it's almost the same plan design. The commercial plan that everybody moved from and what employees and pre-65 retirees have, and then the SilverScript plan. What changed was the absence of those manufactured drug coupons. So that's not allowed in Part D plans. And that information really wasn't made available to Harris County when that was, being formulated for, even as it came to court. So it was, I think, again, in absence of knowing how many people are using coupons to with their commercial plan, we didn't know the full impact of what retirees essentially experience when they can't use their drug coupons like that.
I would say from talking with the finance director and you all earlier, the comment was made, healthcare costs are going up, even with this 129 million dollar budget deficit that we have to deal with, the balance this year's budget. What was the number? Close to 40 million, 30 some odd million.
38 million.
About 38 million is going to be a problem down the road for healthcare benefits. And one reason why cost is going up would be designer drugs. Obviously, people want to take the one, I take 4 or 5 pills a day. And one that was a little cheaper would make me nauseous and I would get up dizzy. So they put me on something else that is more expensive, but I don't have to rush up to run to a meeting and fall down because I'm dizzy before I get some food. And the other reason was because the cost of anything involving plastic has gone up, in part because of the war going on right now. But healthcare costs is a big driver, and I'll be one of those arguing that the one place where I won't compromise. Just going back to that experience, if I had, God forbid, if it comes back and they worried about what again, the doctor said when you get over 60, guess what? You get spots. We don't go in and operate every time that's a spot. If it grows and they think it's malignant, they got to go check. And it could create a problem when they in there looking. So they watch to see if it grows. But you got to do tests for that.
Commissioner, to your point about costs, I think maybe it would be great to hear from Boomit
Yeah, Boomit.
About how each option would affect the county's long-term budget and sustainability of retiree benefits, and also what Medicare's role is in the cost that the county pays. Right?
No, that's a good question. Commissioner, you touched on this a little bit, just around where we are this year for the deficit and then where we were last year. On top of the stuff that you mentioned for last year, we also had higher indigent defense costs. We also had higher healthcare costs for current employees. So all in all, last year, our deficit was over $200 million. So it's a pretty big number. So that's why we were looking at, we were done looking past the couch cushions. We turned the whole thing upside down to look at just what we could look at that would have the least amount of impact on employees or retirees. And so that's how we got there. And the option was savings of $9 million. So that helped kind of bridge a portion of that gap. And, the cost of the other option that's been discussed by the HRT team, that's about $2.6 million overall in total costs. So, I think if we go down that path, it's still a help to the county's budget deficit, that $129 million that you mentioned that we're trying to dig ourselves out of for this year as well. So there's that piece of it. So I think that's helpful to know and understand. And then in terms of how Medicare plays into it, in the commercial plan, you basically have the copay that the retiree pays, and then Harris County covers the difference of it. Whereas where Medicare gets involved under the Medicare plan is where Medicare gets involved and they cover a portion of the eligible costs. So it provides a reduced cost overall to the county. So I think that's a big help overall for the county's budget perspective.
And with 2,100 people on this line right now, you get a bit of a budget lesson. So the perception that the county's just flush with cash is just not reality. And with revenue caps that are placed on local governments about a state, we get our money from property taxes. The state gets its money from sales taxes. So like with FIFA here, the money, all the people came in who rented cars, rented hotels, bought ice cream, went out to dinner. The bulk of that money goes to the state. That's sales tax money. Then the second largest amount goes to the city of Houston, considerably less than what the states get. The least amount of money goes to the county. In fact, we'll get the numbers at some point and find out. My guess is we'll be lucky if we break even in terms of what we did. So what we charge on rent for the stadium would not cover security and all the other things that we did, but you just get a lesson. So the short question is, one big driver on the budget is employees. That's the largest category of where we spend money. And a big driver, in addition to our salaries to work for you, would be healthcare. And that's why I always stress, the best way to reduce healthcare costs is, big part of it is obesity. We got to eat less. We got to eat the right stuff, the stuff with the sugar and the salt, no good. You know what I mean? So it's weight. So stay active. Let's take another question there. If you want to read one, I won't call that person's name.
Sure. The next question is, why weren't retirees notified before being enrolled in SilverScript? Heard that we just received a letter, but maybe weren't notified. Can you talk a little bit about what that transition process looked like and what it would look like moving forward if we do make these changes?
Right, so we did send out letters. Part of the open enrollment packet there was, because at this point, when the decision was made back in August, we had a finite amount of time to get everything configured, to know that we were going to be able to make the target date of February, because we knew we wouldn't make January, so it could be, aligned with the plan year and, much easier to understand. But from a configuration with the file that has to go to SilverScript and CMS and all the missing Medicare beneficiary IDs that we had with our retirees, we had a lot to work to get to that point. So in our open enrollment packets, there was a letter insert, and in that letter, we mentioned, or we stated that we would be moving to SilverScript for those that were, eligible for Medicare. And then we sent out letters, I think it was close to like end of November, notifying them about the webinars that we were hosting in December, which were, informational webinars in partnership with SilverScript to be online and answer those questions. We had, I think, a couple hundred at each of those webinars, and we sent follow-up emails. We, took questions during that. And then I would back that up. During open enrollment, we actually had SilverScript sit at some of our open enrollment meetings, the in-person meetings, so that way they could also be, provide some information in the meeting, but also answer any questions leading up to that change in February.
So we send it by snail mail, but there's a lot of mail that comes, people don't, look, I'll renew a credit card and put it in the trash because I think it's somebody trying to
Right.
get me to take a new credit card. It happens, particularly if I get a card for one of my kids. It's renewal. I'm thinking somebody trying to get a card, but it happens. This format helps a bit. We may try that. At least what retirees, since this was, as I said, it was so quick. We made a decision very quick, and we thought we were trying to figure out how to save that $9 million, which is only a small part of a $200 million shortfall. There were a lot of other things that we did as well, and we'll go through that again. Separate issue. Maybe we'll do a telephonic town hall meeting on the budget, but sometimes I raise the question: do we have a structural deficit? To me, a structural deficit is important. Is if you keep having it, that's a structural issue every time. But it's a problem in terms of having to spend more, costs going up. I think I heard the comment earlier. Healthcare costs went down considerably during the pandemic. Could look at it a number of ways. We were losing a lot of people, but we weren't going to the doctor. We were not going out. And then obviously when it ended, you had healthcare issues related to depression, a host of other issues that came up. So we are adjusting to that big bump after that was a lull, in part because even if we should have been going to the doctor, we were going, and which may have been good because the doctors were not going either. You will just grab at random, so we jump around, not necessarily who came in first.
So one of the questions is where retirees can get information in writing. Is there some place we can access what the
Is it
proposal
online?
is?
Like at those letters?
Yes.
And where is that?
Yes, so on our website, so benefitsathctx.com, we actually have our retiree town hall page. And we've been emailing that out since acquiring about 5,000 emails from our TCDRS. They've partnered with us and we've leveraged like getting, the best, more cost-effective way of getting information out quick. So our website is where we have the proposal that was shared, the different options. We have last week's town hall posted, and we have
It's going to be posted.
yeah, and this if
And
this
is
is
it
recorded,
easy to
yes.
navigate?
Yes.
Yeah. Like sometimes, and if you have ideas, let us know, call the department or email one of our offices, Don't necessarily just tell us on social media. I mean, it's kind of hard to go trace all of that, but you can always try to make them, to make them better. But it's on the website.
Got the court documents as well.
Yes.
So you want to watch court on Thursday or check the materials.
Yeah.
Another clarifying question, is the new program only covering generic brand prescriptions? And you talked about this, yeah.
Right.
Yeah.
I was just like restating what the new copay structure would be. Generics would be $0, all generics. That's tier 1, but the plan still covers what we call tier 2, which are your brand name drugs, tier 3, which are non-preferred brand name drugs, as well as tier 4, which are specialty drugs. And those are all set at low copays.
Right, so they would still be covered.
Yes, that's correct.
Yes.
You all pulling them off as we go through them so we don't go back to the same question.
Yes, sir.
Okay. You want to grab another one?
Sure. There is another question about if we're able to go back to the old plan and if we don't, what prescriptions would look like with this new plan.
So again, like they would be low cost. So we'd be able to they would be able to fill their prescriptions and have, a $0 copay if they have, generic meds. a $20 copay if they have any, brand name drugs, non-preferred brand because I got all this memorized in my head. Non-preferred brand becomes $35, and if they take any specialty medications, those are $50. And that's for a 30-day fill. Again, if they have staying in Medicare Part D with the Silver Script plan, there is the true out-of-pocket, which is that maximum out-of-pocket that you would pay. And so if they hit that, all your medications under Medicare Part D become $0 for the remainder of that plan year. So again, that's a very huge protective factor. You have the set co-pays, and then once you reach that, again, we've got a few, through about 300 members that have already reached that in the first 3.5 months of this plan, that their drugs are no longer, any cost to them. They became $0.
How many retirees do we have?
We have a little over 6,500 retirees. We got
a fourth of them on here.
That's great.
And it's second. So if you're watching this online, at 2,124 people on here, and we left 12,504 messages. Let's grab another one up there.
Sure.
There's a question from Facebook.
Okay.
Will Harris County still offer Medicare Advantage for 2027? If so, what are the dates to enroll?
Yeah, so we do have a Medicare Advantage plan offered by Humana. It's actually a Medicare Advantage with prescription drug, and it will be back for 2027. We are doing open enrollment coming up in, I think we will be kicking that off September. So that would be the time to make that transition, and we'll be doing a lot of communication during that time to all of our retirees.
As we go to the next question, I'm gonna give you some more advice. If you get your eyes checked and they change the prescription, it's a minor change, don't go 3 years without doing it. That's why I can't see what's up there. So grab another one.
There's another follow-up question about the troop. How do retirees know what percentage they're paying goes to that 2,100 maximum out of pocket? It's hard to get information on that. So how do they know? And do they need to know? How do they know once they've met it, I guess?
So I think Silver Script might be able to answer that question better because, like I said, there is a mechanism. CMS calculates that true out of pocket differently from what you're physically paying at the pharmacy counter. So they're using the Medicare Standard Part D plan, and that's how they're taking the cost and applying that toward that $2,100, not necessarily what you're physically paying. So you're moving a lot quicker than what you pay out of pocket yourself. But I don't know if Randall, I
I
don't know how
think
we
we
can
have
connect
Silver
with him.
Script on the line. If you're able to come off of mute.
Oh, I forgot they're on the line. I forgot. I'm sorry. We got wound up. Silver Script.
Yeah.
Hello, can you guys hear me okay?
Yes.
Yes, we can hear you.
Terrific. Hi, everybody. My name's Randall. I'm here with Aetna and Silver Script. So great question. The best way to track on what your spend is going towards your out-of-pocket maximum or that troop amount is to look at your monthly explanation of benefits that you receive once a month from Silver Script in the mail. You're also able to log on to our website, caremark.com, where you can register with your member ID number that is located on the back of your Silver Script ID card. And you can also view that progress towards that true out-of-pocket amount online as well. So a couple different options for you. Or as always, you can just give us a call. Our customer care service team is always ready to take your calls and help you understand where you're at in that process. That phone number is 833-823-2260.
Thank you, Randall. We have another question from Facebook. Can you talk about how the retirees' health plan compares to the active employees' health plan?
Let's say health plan wise, because that's broad, that could be medical and RX. But essentially, if you're enrolled in our, in Aetna plans, so your base or plus plan, you have, the same plan design, co-pays and such for going to your physician or, using any of those services on the medical side. However, if you're Medicare primary, Medicare is, coordinating first, and then what comes after that is picked up or, they apply that toward your plan with Aetna. RX, the RX plan, when we move to Silver Script, now that for retirees that are 65 and older or Medicare eligible, You do have a separate prescription drug plan, and that's administered through SilverScript, which is part of Aetna. And then employees have the same, or not have the same, they have the commercial plan, which is administered through Aetna CVS. Now, the plan designs are very similar. Like I think I've stated, they are co-insurance with minimums and maximums. However, in the commercial plan, they are allowed to use manufactured drug coupons for brand name drugs, whereas Medicare Part D does not allow that. So that's where I think, again, some of the pain points of having, higher out-of-pocket costs because you might have had one of those coupons in place at the pharmacy counter.
But your proposed changes would address that.
Yes, yeah, the low flat copays on the retiree proposed plan design would, make that very consistent, lower your out-of-pocket cost, and honestly, it would be a much more pleasurable experience even if you remove back the commercial plan, because you're not having to deal with potential like, is this drug going to cost me this much, because it's a co-insurance amount. It's very consistent, and you can kind of plan your budget even around that for the year.
We have 21 minutes left, so press 0 if you have a question. Did we go through the other questions that you all worked up? Like moving any of these you want to go through?
Sure, I can ask one of the follow-ups we had for HRT, and just an opportunity to go into a little more detail about some of the stuff that we've already talked about. But can you talk about how the enhanced formulary will ensure coverage for nearly all of the medications that retirees currently use? And how did you determine that this would cover most of those drugs? How do you know that? Sure.
Yeah, we'll be happy to talk about that. I'm going to let you go into the details, but what we'll tell you is based on current experience. So we do want to be transparent that things can change either in the commercial plan for the actives or in the SilverScript. So we looked at the current formulary and assessed exactly what drugs are currently being utilized, and then Sarah will explain.
Correct. Yeah. So we took 3 months of claims data, SilverScript provided, and so they ran that against the current formulary as well as that proposed formulary, which is open. It's very broad, and I think it's one of their richest formularies, if not the richest, with SilverScript. And so based on actual, utilization for this year, February through April, end of April, it came out to where the Comprehensive Plus is 99.9% of all of those drugs covered. Meaning, like, even if you have to have an exception in place, your drug becomes covered and you don't have to worry about having that on file. There was only 3 drugs on that formulary that were not considered covered, and they're only taken by 4 members. They're a mouthful, so I'm not going to list them off right here. But again, there's an exception process just for those 3 drugs. So the other formulary, the one they currently sit in, called Classic Plus, that covers 96.8% of drugs. So anybody that's taking, a non-formulary drug, they've had to go in and have an exception made through their provider. And again, that's a bit of a hoop, and I know that's caused quite, some stress or distress for our folks.
It might be worth noting, we can answer that question, will GLP-1 medications be covered? Because this is a good example of what's a win in the SilverScript.
Yeah, so also another benefit to Medicare Part D plans is that beginning as of July 1st, they cover weight loss drug, the GLP-1 weight loss drugs. And there's specific ones. It's Wegovy, Zepbound, and then another one that I cannot think right now. But there's 3 GLP-1s. And so it's outside of the benefit. And so it's a set copay of $50 a fill or $50 a month. And so you still have to meet those eligibility, FDA, requirements for, taking that drug, but you actually have access to that. Whereas in our commercial plan, where all the employees sit and our pre-65 retirees, they do not have access to that. It is, we projected costs for that. We were looking at even potentially trying to leverage something early last year, like what that would look like. And it is very expensive to consider adding in those drugs at this point, for our budget and stuff. So in this world, in Part D, we have members taking Zepbound and Wegovy already, just based on the formulary information or the formulary analysis that was done. And so they have those drugs at $50, set copays. And so it gives them that access they need.
I'm just curious, Andrea, because you came from the private sector. Is the insurance here better than the insurance you had in the private sector?
Yes, it is, and definitely on the retiree side.
Yeah.
Many private sector employers don't provide retiree
And
pharmacy.
I want to stress, sometimes I tell my friends in the administration, for retirees in particular, a lot of people stayed with the county and made less income because of the healthcare benefits. even when I was on city council, and I had my own little small business, I didn't take the insurance from my small business. It was not as good as the city's insurance back when I was a council member. And when I went to the state senate, I didn't take the insurance benefit from my law firm. For a while, I was with the largest law firm in the world because the state's insurance, the government's insurance was better than that from the private sector. So sometimes when the argument comes up, we're doing more than the private sector does. I point out people in the public sector make less and in many ways work harder. I know I worked harder on that $600 a month job than the one that was paying for my children's college. And here, I mean, it's a tough job. I just want to stress that, knowing that. That's why I'm so sensitive to it. I want to make sure we didn't skip any questions for movement. Like one was, did we go through how each option would affect the county's long-term deficit and sustainability?
Yeah, there's about the budget saving that we had built into last year, about 9 to 13 million is the cost that we would have to add back in. So on top of that $129 million deficit, if we were to go for next year, we would have to add about 9 to 13 million dollars of additional costs if we were to go back to that commercial plan. If we do the formulary plan that these guys have just kind of talked about, with those 3 addition options, that would just add about $2.6 million worth of additional costs.
Well, being from the sunny side, I keep it simple. I remember the dollar amounts. When I know y'all, I really read this stuff on Sundays. Problem is now with me on Thursdays, I may forget something by Thursday, so I got to try to find time on Tuesday and Wednesday to read it again. But initially, I was going to push for the commitment that was made on tape when this came up, because I didn't know how you could just go have $9 million, 9 or 7,
No.
a $9 million savings, and nothing would change. And I asked the question, just somewhat of a leading question, but when on the fly, when everybody's rushing, to go make those changes in the budget. So with 2,124 people still on this line, even if you're there, when I read it over the weekend by myself, should have been at church, worried about my health care. I didn't call staff, but I read it. And I came to the conclusion from what you all gave me, you had all the options there, that this $2 million-ish, 2.9 you said, right? 2.6 million dollar option, it takes, you got to adjust to some changes, but I think it's a better deal. And if we drop another $9 million on the 120 something, 127, 129 million dollar hole that we have now, I can't relitigate where we are. I voted against the budget, by the way. I think I said the second time in my political life I ever voted against the budget, knowing you got to operate the government, but I just didn't like that last minute, on the fly, kind of decision. But it was partial. There's a bunch of other stuff, not just this. But I think it's a pretty good option, and I want to stress that to you all. That's where I'm headed. I'm just one vote. But so far I think I got the largest crowd by doing this meeting. Let's go to a couple more of these questions. I'm gonna when I get my eyes checked this year, I'm gonna go on and get the prescription filled. I can't see them. Can you see?
Yes. So there's a question about a prescription that was denied for a retiree. So Sarah or Andrea, could you talk about what the retiree advocacy service might be able to do to address situations like that?
Definitely.
Right, so I guess restating, sorry, I was looking at something.
Oh, no,
Someone was denied.
Someone was denied a prescription. So what are the options available to them when that happens?
So with the advocacy, and even now, like if you get denied, I would say call our office. Please call, 274-5500. We need to hear about it. We want to make sure we've got, a customer service team that's going to, make sure that if it needs to be escalated or if, SilverScript and Aetna need to kind of get involved, that's going to be assisted. We don't want you to not have your drugs filled, or if there's an option to get an exception, make sure that the provider pharmacy piece is connecting. With advocacy, that helps provide a much more wraparound service. And so again, it would probably start very similar, where you reach out or they're reaching out to you to make sure things are going okay, and then get in the middle of that between the provider and the pharmacy and do a lot of high level concierge service, so that way way you know that it's moving along and getting addressed, and it's not something that you're having to come back to and keep following up on. So again, we've got this baked into the Humana plan we have, and we have, and actually the plan design, the prescription drug plan is the same, and we have no negative feedback on how that works. And I think a lot of that has to do with that advocacy piece, because I mean there are a lot of high needs in this situation, and so that really helps get that and move it along. And you're working with that same person that has been trained in Medicare, very sensitive to like what's going on, and if you have other issues that come up regarding questions about your other medications and stuff, that's going to be part of the conversation, that it's not going to be just fix it and then move on, or answer the question and move on. So they are a very holistic way of addressing our retiree needs.
Thank you. And to folks on the call, again, you can press 0 if you have any questions that you want to ask. I think we have addressed most of these, but I think just to clarify for non-Harris County retirees in the audience, who does this apply to? Is this all retirees? Who is affected by this?
So for this is everyone, all retirees that are Medicare eligible either by age or disability. And so anybody that is currently enrolled in our Aetna Base or Plus plan, that is who it's impacted. So, moving forward, if this is, continued into, 2027 and you're aging into Medicare, or you become disabled and eligible for Medicare, this will eventually impact you. And so again, a lot of communication, we have an age-in process bill that we've had to kind of build on the fly, where we notify our members that are aging into Medicare now, to let them know what their options are, the information that we need from them to make sure we transmit that appropriately. And we do that reach out probably about 3 or 4 months in advance, and we start phone calls, postcards, a letter, and such. So I have one team member working that spot, and it's quite the busy desk for her.
So I see too, it looks like it says for Sarah, why weren't people notified about the RMA letter?
The IRMA.
Yeah. And if you don't know, we can follow up. We'll give you that person's number. And
Right.
does Silver Script affect people over, is that 75, it's a 95, what is that?
Under
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 65.
65, yeah.
No, so Silver Script does not affect people under 65 unless you're Medicare eligible. But as you're getting closer to 65, it could potentially be something that you have, coming up, and so that's how that works with being
I saw
Medicare
that
eligible.
about repeating the number to call if denied.
Yeah, the number to call and the website, if you want to repeat
Oh,
that, Sarah.
yes. So the Benefits and Wellness Office, that's the Harris County, team, and they sit with, that's my Benefits and Wellness team. It's 713-274-5500.
Is that something that you all put out that shows what it was and what it is? So you can pull out, is that on a website, like what's
Yes.
different? So we're trying to teach them how, at least from the memo my staff wrote to me, made it sound like you all were recommending that option because it's different, but they get a better deal. Is that simplistically what I was reading? But so they can look at it, because everybody always believes the government's here to help you. That's what we always say. So is that something where they can see what they had and what you have, and how is this better? If you go through different hoops, you get a better outcome.
Yeah, we have this plan or this proposal on our website on the Retiree Town Hall page. And I know we've emailed it to all of our folks, a little over 5,500 email addresses that we did have last week on Monday. So they also got that as an attachment. So it does sit out there, and I know we can follow up with that as well as even put a banner up. I'll get one of my folks to put it up as the main banner on our website, so they can just click right there.
Did I hear you say you do surveys?
Yes.
Have you done surveys like to ask them, is this clear? Or what can we do to make it clearer?
We did ask about communication means, and
Right. We did ask like how they would like to be communicated, how they like to receive information. And so the feedback was overwhelmingly more like digital information. I think, surprisingly, not a lot of folks, at least in the survey, we had about 460-ish retirees take that survey that we had this past month. The in-person wasn't as high as webinars, emails, I would say like any type of thing where we're doing, digital communication.
Most retirees can't get around like we used to.
I guess, I don't know.
I have to ride my bike to the meeting.
There's been a change, yeah, especially since COVID.
So you may think about this for me, because unless this computer is jammed, unless we've been hacked, there've been 2,124 people on here for a while, for the last 30 minutes. So, so you may think about this format. Look, I want to thank, if you all have it, I want to thank all of you all. I know you had a full day and you came to do this at night, and my staff as well. And I want to thank you all for listening. If we skipped any questions, or if you send one in before we close this call in about 3 minutes, I'm gonna see if they have any closing comments. Send it in there. We know who you are. Well, we know your number. Maybe the wrong name on it. We'll follow up to answer. But look, we try to do as much as you can to communicate. I mentioned I'm in my workout attire, and it's too hot. I'm gonna go walk the hill at Sims. If you hadn't read about it, it's a spectacular view of Houston. I'm gonna put the mosquito spray on before I go. But I want to stress to you, I think I'm accurate on this. At least it says that on Chat GPT. If it's not wrong, again, many folks say the number one cause of death is something related to obesity. So that's a hell of a deal. If the number one cause of death is what we put in our mouths. So I would encourage you to pay attention to that diet, stay active. Some of you know I'm a cyclist, a avid cyclist, and every time I leave my doctor's office, she says, Rodney, don't fall. And when you get over a certain age, if you fall, there are just issues related to it. So I don't walk up the stairs on the phone. I don't walk down sipping coffee. I have one hand on the rail anytime I'm walking. So just be careful. Any closing comments you all have?
We definitely want to thank everyone for all the input, and we also recognize that there are key issues that we've worked very hard to try to address. And so thank you for your support, and thank you for all the feedback.
Yeah, I know, I appreciate there's a lot of frustration around some of this stuff, and I know that the HR team has done a really great job to try to fix as much as we can to get us back on the right track, and I know we've been doing our best to help them along, so whatever we can do to help.
Yeah, I appreciate this opportunity. This has been eye-opening just from the numbers that we got. So we appreciate y'all leveraging your resources to help us speak to our retirees.
Staff, I didn't follow all your script.
That's
And
fine.
y'all wanna,
We
you know,
covered all of
we
the
covered
questions.
it.
Yes.
Even if I rambled around, I get to all of it.
Yes, sir, you did.
Thank you all. 2,124 people. Hit the gym. Good night.